So apparently, the FDA is now responsible for milk tyranny, Chinese vape crimes, and pushing the great COVID hoax. That is, if you ask the Republican Party's medical all-stars of Marjorie Taylor Greene, RFK Jr., and the FDA guy commissioner, Marty McCary. They're competing to see who can say the wildest thing to a microphone without triggering a lawsuit. Because when you're anti-science, even nutrition facts look like fake news.
We can also talk about how the FDA bans raw milk, which is ridiculous. Raw milk is sold in countries all over the world. Countries like England, New Zealand, France, Italy, Germany, Norway, Sweden, Finland, and Denmark. Raw milk has been here since the beginning of time, and many Americans not only produce raw milk, they'd also like to sell it, and many consumers would like to be able to buy it. But the FDA has declared war on anything natural and good.
Let's deregulate the dairy aisle because of the good old days. You see, Marjorie Taylor Greene wants people to believe that if it was a policy of several decades ago, despite scientific studies, it must be good for you. I mean, even if it's carrying diarrhea-causing bacteria on the side. But she wasn't even done there. Because when it comes to food policy, Greene doesn't pivot to nutrition. She takes a hard left into chemical warfare.
The FDA is a failure to approve new nicotine products, which are safer than cigarettes, has spawned a massive and dangerous illegal market of Chinese vapes. No one trusts many of the products, especially anything laden with chemicals coming from China, because China, after all, has been murdering Americans for years now, and Americans are dying every single day from fentanyl that comes in our country.
I don't know, man. I feel like we can be careful about both nicotine and vaping products, considering both of them are known to cause some serious health problems in people that use them at this high rate. I mean, her choice to advocate for nicotine sounds like a certain industry has been stuffing her pockets to give them an advantage in this arena. So, as usual, in order to push her agenda, she has to go to MAGA's standard of scare tactics of claiming that China is slipping fentanyl into our cereal without our knowledge. The fact that we're even happily buying these drugs and vapes at this high rate should force us to analyze why so many people are self-medicating or feel the need to escape constant stress of our predatory society fueled by our unlimited capitalism. And while she's talking in the FDA, the agency's own leader can't seem to get basic facts straight in real time.
You just said don't trust the CDC.
We're saying it's going to be between a doctor and a patient until that committee meets or more experts weigh in or we get some clinical data. If there's zero clinical data, you're opining. I mean, it's a theory. And so we don't want to put out an absolute recommendation for kids with no clinical data.
So you made this pronouncement as well on pregnant women. There is data. Researchers in the UK analyzed a series of 67 studies, which included 1.8 million women. And the journal BMJ Global Health published it. People can Google it at home. And it says the COVID vaccine in pregnant women is highly effective in reducing the odds of maternal SARS-CoV-2 infection, hospital admission, and improves pregnancy outcomes with no serious safety concerns.
There's FDA Commissioner Marty McCary on national TV being asked to explain their confusing and conflicting COVID guidance and sound like he just heard about these other studies in real time. So this constant back and forth of telling folks to not trust the CDC, but discuss vaccines with their doctors based on nothing causes a little bit more confusion, especially with a guy like RFK Jr. leading his HHS with an embarrassing story every day about them fudging information and turning science on its head based on nothing. You'd hope that our health agencies would at least rely on available data until you find out what they did with the data that could have been available.
So here's the data on pregnant women. A randomized control trial was set up and it was closed without any explanation. We wanted to see that trial complete so women can have information that in a randomized control trial, which is the gold standard, this is what the data shows. We don't have those data.
All right. It is still unclear what pregnant women now should do until they get the data that
I'd say talk to their doctor.
When do they get the data you're promising? All these controlled studies.
In the absence of data, they should talk to their doctor, and their doctor will use their best wisdom and judgment.
FDA Commissioner, thank you for trying to help clear this up.
So apparently the FDA shut down a COVID vaccine trial for pregnant women without any explanation. Then they used the absence of that data to then dodge giving medical guidance that I would assume the doctors should rely on to discuss these issues with their patients. I don't know what's not chaotic in this administration's policies and actions when it comes to really anything that they do.
The modern medical establishment really has been disconnected. We've been so busy focusing on treatment, on billing and coding in a high throughput model. We've got to stop and ask ourselves, should we be focusing more on school lunch programs, not just putting every kid on Ozempic? We've got to talk about food as medicine and gut health and the microbiome. We've got to talk about environmental toxins that cause cancer, not just the chemo to treat it. And maybe we need to treat more diabetes with cooking classes, not just throwing insulin at people. This report is a fresh new approach that really calls for a transformation of our healthcare system.
All we need are full thought processes. I mean, I don't think too many people disagree that eating non-processed foods or eating healthier will actually have some positive effects on our bodies and our health. But when we're led by the same kinds of folks that encourage large corporations to do the exact opposite for the sake of the deity of capitalism, we ignore food deserts and that activists have been talking about for decades, and then they preach about zero regulation in our air and water quality so that the corporations that pay our politicians can make as much money as possible. The message and the reality never really match up. It's no wonder people aren't buying what this team of health experts is selling. They've never been straightforward. I mean, remember when RFK Jr. talked about this during the campaign?
You have gained notoriety for your skepticism about vaccines. And over the summer in an interview, you said, quote, "There's no vaccine that is, safe and effective." Do you still believe that?
I never said that.
So stop me. We have the clip. Please play the clip.
You've talked about that the media slanders you by calling you an anti-vaxxer. And you've said that you're not anti-vaccine, you're pro-safe vaccine. Difficult question. Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective.
Okay, so this is where we are. A government health agency being pulled apart by incompetence, conspiracy, and ego, while Americans are left to guess what's safe, what's not, and whether or not our own leaders even believe what they're saying really on any given day. It's all part of this administration's onslaught of misinformation and disruptive policies that come at people so consistently they don't even know what to expect. But if we stop and pay attention, the one thing that they're laser focused on that never really wavers is their commitment to siphoning as much money and resources as possible, while the majority of the country is left fighting with each other over our confusing health policies, just like everything else.